So my primary duties as a social worker is every day I come in, log into our computer system, and I start receiving those reports. I review any reports that have come in from my veterans since the previous day to see what's changed. They answer questions that are tailored to their specific needs. If they have anxiety or depression, those questions that they answer on their health check every day are based on that type of an issue. If it's on substance use disorder, it asks some questions about, have you had any urges or cravings? Have you had anything to drink? Have you had anything to use? But the questions are tailored specifically for their needs. And I review those, and if there's anything out of the expected range, then those are the ones I call first.
Oh, wow.
If there's no response, if the veteran didn't answer the questions for that day, or it's been a couple of days since they've answered the questions, then they take a priority, and I call them to find out what's going on. People dealing with mental health issues sometimes don't want to answer the questions when they're not feeling well. They're embarrassed by how they might answer, and so they just avoid answering at all. And that's an indicator that something's going on. And so we call and reach out to them and talk to them, again, to try and catch anything before it becomes a crisis situation. During the day, I make phone calls. I'm continually assessing their needs, adjusting their treatment goals while they're working with us, calling other parts of the hospital to coordinate care with their primary care providers, with the pharmacy to help with refills on medication, with prosthetics to make sure that they have durable medical equipment that they might need, like a wheelchair or walker, things like that. And then, in addition to those responsibilities, I work with a PAC team, the Patient Aligned Care team, and I meet with that staff every day to touch base so that if they know of somebody who's coming in that might need additional assistance, the social worker on the team can be assigned to start looking into that before they even get here, so that when they come, they don't have to spend extra time in the waiting room or just sitting around with nothing to do, so that the social worker can be aware of who's coming in, when they're coming in, and be proactive in trying to address what their needs might be. Maybe there's something they're following up with from last time they were here, but the social worker can plan that into their day and be available when the veteran is scheduled to be here.